Deuk Majin. We are live from Deuk Spine Institute, our surgery center. We're performing a procedure with the endoscope and laser to repair 2 discs in a patient's neck. He has 4 disc herniations, but only 2 of them appear to be symptomatic, the bottom 2. That's where his pain is. So we're going to fix 2. And he's already had facets treated earlier. He had his lumbar facets, cervical facets, sacroiliac joint, and piriformis muscle. The facets in his lower back were on the right side. His neck, left side. If you have questions, feel free to ask me. Just type them in the dialog box. We're streaming on multiple platforms, including Facebook, YouTube, LinkedIn. I'm not sure why we're not streaming on X, but Henry hasn't told me that yet.
It was for me and Margie. It's for analytical reasons. Having her here would have it better to explain why, but we want to be the primary focus on the 3 Facebook, YouTube, and LinkedIn.
How about this Truth platform?
We looked into that last year, and there's no way for...
but there may be a way to stream on Truth now.
No, well, there could be, but when it comes to... I could check. Hold on.
All right. 5-6-6-7. We need to get rid of that wire. Anyway, Henry, in the meantime, while you're checking, let's show the audience the 30 different causes of neck pain. Thank you. I'm Dr. Deuk Majin, CEO and founder of the Deuk Spine Institute. We're going to talk about the 30 causes of chronic neck pain. Chronic neck pain is neck pain that lasts longer than 6 weeks. There are 30 causes to chronic neck pain. The most common cause is the disc. There are 6 discs in the neck. These discs can become injured. The first disc is C2-3. Next is C3-4, C4-5, C5-6, C6-7, and C7-T1. The most common disc to be injured and cause neck pain is C5-6, followed by C6-7, followed by C4-5. The other discs rarely cause pain. Discogenic pain represents 85% of chronic neck pain. Next, the facet joints cause 10% of chronic neck pain. Facet joint pain is very common in patients with neck injuries and spine injuries. Facet joint pain is usually located on the sides of the spine, either right, left, or both. Facet joint pain gets worse with rotation of your head and neck, worse with extension. The most common facet joints to be injured are C5-6, C6-7, and C4-5. C7-T1 is another common facet joint to be injured. These joints, after injury to the capsule, will develop arthritis. It is the arthritis in and around the facet joint that causes the neck pain and stiffness with movement. Deuk plasma rhizotomy is the best treatment in the world available for painful facet joints. Deuk laser disc repair is the best treatment in the world available for painful discs. Other causes of chronic neck pain include fractures, tumors, infections, and muscle spasms. These other causes represent less than 1% of chronic neck pain. Thank you for joining us for 30 causes of chronic neck pain. Sean, welcome back. All right. Had a hell of a time getting to the disc, lateral. He's got a very thick neck. Honestly, didn't expect it to be so thick. I need to pull it back a little bit. Shot. And see where we are. Shot. 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 All right, AP. Quickly, shot. That's not bad. It's actually pretty damn good. Right in the middle. Shot. 2, 3, 4, 5, 6, 7. Give me a pull and shot. Come on, Luis, get the shoulders. All right, shot. Got to get both sides. Can't just do one. Whose fingers are those? Shot. Shot. 2, 3, 4, 5, 6, 7. Looks good. Let's do shot. Let's do an injection. We're starting at 6, 7. It's the hardest disc to get to. We're going to do a discogram shot. Very good. You can see the herniation in the back. All right, let's go with the guide wire. If you have questions, ask. Have you done the 30 causes of neck pain?
Yes, we have.
Now let's show how the disc can be so painful and what we can do with the laser to repair painful discs.
Disc injuries start with an annular tear. Damaged nucleus pulposus herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963. Disc injuries is a common cause of chronic neck pain. The inflamed annular tear causes neck pain. A 4mm skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes herniated disc fragments and debrides the posterior annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963.
Welcome back. You can see from our video that we go in with a laser, repair the annular tear by debriding it, remove herniation, remove calcification, remove granulation tissue. Right now the tip of the dilator is in the tear at the back of the disc where the pain is coming from. We're going to go back and basically remove the herniation, debride the annular tear, and let his disc heal naturally. Other doctors might recommend fusions, artificial discs. I used to do those. I've done 1,000 cervical fusion, artificial discs in my career. I stopped doing them because laser is a much better treatment, safer for the patient, better result for the patient, and no need for metal or any other type of implants going into their spine. It's a natural way to fix the problem without metal in their spine. Shot? Thank you. Any questions? Shot?
At this moment, no current questions.
All right, we're there. Now we're gonna do the entire surgery through a 4mm tube. You guys see that? Small tube, no bleeding, no downtime. This patient can go back to a normal life the next day with some minor restrictions. We've been doing this surgery for 20 years here at Deuk Spine Institute. Endoscopic, laser-assisted annular debridement, 20 years. We've treated over 2,700 patients with this problem. All right, let's get started. Any questions, feel free to type them up. Laser is on. All right, let's go fix our first disc. Henry, We've shown the 30 causes of neck pain.
Correct.
We've shown the Deuk laser disc repair. There's a piece of herniation right there at the back of the disc, C6-7. We're going to go grab that thing out. Guys, it'd be nice if I can see the hole here. There's another herniation. Henry?
No current questions. We did the 30 causes of back pain. What causes neck pain? 30 causes of neck pain. What causes herniated disc at the neck and how to cure it. And so right now, the one thing we have left is the Deuk laser disc repair versus all invasive neck treatments.
Sounds good. Let's do that one.
Copy that.
I'm Dr. Deuk, CEO and founder of the Deuk Spine Institute. I'm here to talk to you today about neck pain and its common treatments. Neck pain has different causes. The most common cause of neck pain is a herniated disc. Herniated discs account for about 85% of chronic neck pain. The second most common cause of neck pain that's chronic is the facet joints. There are facet joints on both sides of the spine, left and right. There is one facet joint for every disc. Facet joint pain requires a different kind of treatment targeted at the facet joint itself. For disc pain, which accounts for 85% of neck pain, the best treatment in the world is the Deuk laser disc repair. It is the most advanced treatment that is the safest and has the highest chance of successfully eliminating symptoms. Let's talk for a moment about what's important for patients who are considering treatment for neck pain coming from an injured or damaged disc in their spine. The most important thing for patients, number one, is getting rid of their symptoms. The type of symptoms that disc herniations or disc injuries can cause include neck pain, headaches, and symptoms down the arm, such as weakness, numbness, tingling, or even pain shooting from the neck down into the arm. The symptoms of neck pain include disc herniations, which are the most common cause, and patients want those symptoms gone. That is their number one priority and goal. The second most important goal for most patients is to avoid a complication from the treatment. Medical treatments do have complications, and the more invasive the treatment, the more likely a complication will occur. Complications from surgery, for example, can include blood clots, pneumonia, heart attack, infection, failure of the spine to heal properly after surgery. There can be implant migration or implant failure, adjacent segment disease, and vascular complications such as injury to the blood vessels or nerves in the neck, including the trachea and esophagus. Nobody wants a complication from spine surgery on their neck, so less invasive is typically going to be a better option to avoid those complications. The third thing patients really want when they're looking at treatment options for curing their neck pain is they want a quick recovery. People want to get back to a normal life as quickly as possible. They want to go back to their activities, they want to be active, they want to play sports, and they want to go back to work. And finally, the next thing to consider is long-term results. For example, if you have a treatment today and it works, how long will that treatment last, and will it create additional problems down the road for you? Treatments like spinal fusion that are invasive typically result in the need for additional treatment such as pain management, physical therapy, and possibly additional surgery. We're going to look at each of these individually and go through each of these options individually. So we're going to start with more invasive treatments that are typically recommended for patients with herniated discs or degenerated discs in their neck. The most common treatment recommended around the world is anterior cervical discectomy and fusion. That is a surgical treatment where the entire disc is removed surgically through a large incision that is very risky. There's bleeding associated and risk of injury to surrounding structures such as the esophagus, trachea, and blood vessels in your neck. Complications are very common with this type of surgery. The complication rate is accepted at 48%, which is a very high number. So if you're considering ACDF or anterior cervical decompression and fusion, you are looking at a very high complication rate. The success rate of this surgery at eliminating neck pain is very low. It's somewhere on the order of 25%. That is the generally accepted success rate at eliminating neck pain. An additional treatment that you can consider is artificial discs. Artificial discs are very similar to ACDF. The difference is, instead of fusing two bones together with a metal plate and a cage, we're actually putting in a mobile disc made out of metal and plastic that moves. The problem with the movement is that these discs do pop out of the disc space. Over time, they can fail. They can cause collapse of the vertebral body above and below through fracturing, especially in patients with weak bones such as osteopenia or osteoporosis. Those types of patients are at high risk for complications from both ACDF and artificial discs. Another complication from artificial discs is that you can develop facet joint pain and adjacent segment disease, very common with artificial discs and fusion, and they typically have the same rate of adjacent segment disease. There's also a long recovery associated with both ACDF and artificial discs. Recovery can take months to years, if recovery even happens at all. There's tremendous scarring in the wound associated with ACDF and artificial discs, lots of scar tissue, lots of pain, and lots of problems after these surgeries that are invasive. Alternative treatment would be to go in the back of the neck and do a cervical laminectomy and fusion. Again, large incision, high chance of complications, very long recovery, taking years to recover. All three of these types of surgeries, ACDF, artificial discs, and posterior cervical laminectomy and fusion, require the use of postoperative narcotic painkillers. Narcotic painkillers are opioids. They are dangerous. People get addicted to them, they can be abused, and people can overdose. It's easy to overdose on narcotics because you want to keep taking them to treat the severe pain you're going to have after these invasive type surgeries. The severe pain can last weeks or even months, and the addiction can happen very quickly. Let's move into less invasive treatments such as epidural steroid injections. This is a treatment commonly recommended by pain management doctors. They stick a needle into your spine and inject the steroid medicine to reduce inflammation. While this treatment can be effective at temporarily giving you relief for a few days or even a few weeks, the pain always comes back from a herniated disc because the source of pain is never being treated. The annular tear and inflammation within the annular tear is not treated by an epidural steroid injection. The steroid goes throughout your body and causes systemic side effects such as high blood pressure, elevated blood sugar. In patients with diabetes, this could put your sugar up into the 300s and 400s, which is very dangerous for patients. So steroids should be avoided as much as possible. Next, let's turn to spinal cord stimulators. The problem with spinal cord stimulators is they are highly invasive and they are frequently put into patients by untrained doctors who are not surgeons. These doctors are typically pain management specialists, and they're putting these stimulators in patients not because they can cure your pain, but because it's another treatment that they have up their sleeves. These treatments with stimulators pay these doctors obscene amounts of money. The profit for the doctor can be in the tens of thousands of dollars. Avoid spinal cord stimulators. They do not work. They're dangerous. They put you at tremendous risk, and in the end, basically you're taking this device, sticking it on top of your spinal cord and putting a pacemaker under your skin that you're going to have to live with for the rest of your life. They cause scar tissue and they frequently migrate and get out of position. Next, we're going to talk about physical therapy. While physical therapy has many benefits, such as keeping you toned and fit while you're struggling through the pain and trying to stay mobile, but physical therapy will never, ever cure pain in the neck from a herniated disc. It will just try to keep you active and from getting more and more sedentary and developing deconditioning of your muscles because you're sitting around because you have neck pain all the time. Finally, let's talk about the Deuk laser disc repair. The Deuk laser disc repair is the solution for neck pain. If you have a herniated, bulging disc, extruded, ruptured disc, protruded disc, or degenerated disc, the Deuk laser disc repair works by minimally invasive treatment, going to the back of the disc where the problem is coming from. This is the tear in the back of the disc that has inflammation, and using a laser that is extremely precise. The laser fiber itself is 0.5 millimeter or half a millimeter wide, and the endoscope allows me to see 1/20th of a millimeter. I can directly see the nerves and spinal cord. It is an extremely safe treatment. As far as results go, the Deuk laser disc repair has the highest success rate of all the treatments we've discussed so far. We have a 99% cure rate of neck pain coming from herniated discs, and the Deuk laser disc repair has 0 surgical complications to date. Our patients have an immediate recovery. In 1 hour, they're leaving our facility and they're going back to their hotel room. They usually drive themselves in the next morning for a quick checkup, and then it's back to a normal life. Well, I've enjoyed talking to you, and thanks for taking the time to listen to our video. I'm Dr. Ara Deuk-Machen. We'll also find this on our podcast at Deuk Spine Institute Podcast. Thank you. Welcome back. You guys have had the opportunity now to compare our treatment with what the rest of the world does, which those treatments are way too invasive, artificial discs, fusions, and they have so many complications for patients. Patients are never happy with the results. They end up suffering with adjacent segment disease and all kinds of other problems. All right, so this disc, we've cleaned all the herniation out. You can see it's all gone. What's left down there is a little bit of ligament. Any questions?
Yes, we have a question from Mike on YouTube.
Hi, Mike. Welcome.
Saying, hello, Dr. Deuk.
Hi.
What was this patient's symptoms and for how long? Thank you.
Great question. So it was neck pain. Nikki, how long did he have neck pain for? 30 years of neck pain, 30. And by the judge of this disc right here, it looks like a 30-year-old injury. All I've been saying the whole time you guys have been watching that video is, look at all the calcium. It's gone now. I got rid of it with the laser, but there was so much like calcium deposits. We call it dystrophic calcification. All right, just totally in the back, just packed in the back of the tear. Should not be there. All that calcium deposits were from chronic inflammation. So I got rid of it all. We got rid of about 90% of it. There's just a little tiny bit left right here, and we're just about done with this disc. That's the foramen, and you can see there's just a little bit of calcium right there, a little calcified ligament, but no more herniation. The herniation's gone. I'm gonna go look at the other side and verify that the other side is clean, which it is. There it is. This is what we were working on mostly while you guys were watching the video. So 30 years of neck pain, and then he also had weakness, numbness in his left arm from the nerve being pinched. But all that was jam-packed, full of herniation and bone spurs right there, and now it's gone. A little bit left of bone spur right there. I'm zapping away with the laser. Remember, just for scale, the laser fiber is 0.5 millimeter, 0.5 millimeter. Remember, the lumbar laser is bigger. It's twice the diameter. This laser for the neck is 0.5 millimeters, really 0.45, but we'll just round it up to 0.5. The lower back lasers is 1 millimeter. So that gives you an idea of how small of a space that is. Put a little antibiotics in there, make sure we don't cause any infections. We've never had an infection with laser surgery in 20 years. We've done over 2,700 surgeries. This is like 2,710 right here. So we've just flipped past the 2,700 mark. Yeah, all right. Thanks. All right, so we're gonna move from 6-7 up to 5-6. We're gonna do our second disc. Any questions?
At this moment, no current questions.
All right, to move from one disc to the next in the neck, we do the Deuk Spine Shuffle. And this is created at Deuk Spine Institute. When I learned to do anterior cervical transdiscal endoscopic surgery, it was by the South Korean neurosurgeon Dr. Sang-ho Lee, Dr. Gun Choi. They only did one disc at a time. They would never move the instruments up to the next disc. And the reason was nobody knew how to do it safely. But we figured out the way to do it, and that's what we're gonna do right now. Shot. All right, we're gonna move from 6-7 to 5-6, shot. I need to see a little bit more of, just a tiny bit more 6-7. So I'm loosening, shot. I'm stabilizing the dilator with my left hand. I'm pulling out the tube with my right hand. Shot. We're almost, okay, we're out of the disc space. I'm going to come out of the soft tissues. I'm going to hold the dilator in position. I'm going to get rid of the tube off the fluid adapter. Come on, can't let that happen. And I'm going to move my dilator up. Shot. We're going to go up to 5-6. Shot. 2, 3, 4, 5, 6. Now this guy, he's got some really bad discs. They're just in horrible shape. All 4 of them in his neck. He's got 4 that are just totally damaged, annular tears, herniation. But only the bottom 2 are really symptomatic. Shot. So we're outside the disc. You can see we're docked on the front of C6. We're going to go up a little bit more. You see there's a bone spur right above me, like a shelf jutting out. I got to get up 1 more disc space. So here we go. I'm going to move up. Shot. All right, I'm just about there. Shot. All right, very good. I'm happy with that. On the lateral, now I got to check the AP, see where I am. I got to be in the middle of the spine, middle of the spine. If you're not in the middle of the spine, you cannot proceed. Shot. All right, we're in the middle of the spine, but my dilator just slipped and moved, so I got to check. Hold on. Shot. Yep, we moved way to the patient's right. I've got to put it back to the middle. Shot. Hold on. Shot. All right, I'm back in the middle. Lateral. I've just got to make sure I'm still good on the lateral view. Now, the patient, that's really nice actually. I could be a smidgen higher. Shot. That's pretty damn good. Let's get in 1 more AP just to be 100%. I don't want to move off the midline. So we're going through the skin, past the tracheoesophagus, carotid sheath, jugular vein, carotid artery, sympathetic trunk, longus colli muscle with the sympathetic trunk on that. And we've got the vagus nerve in there. So I've got a lot of high stake real estate. Shot. We don't want to have any issues. Shot. All right, we are sliding in beautifully. I want to get another AP. We are at C5-C6. Going to go fix the 5-6. AP. Got to make sure we're still in the middle. Yeah, good. So we're not in the middle because we're heading off to his foramen on the patient's left. But that's fine. That's where I expect it to be. Everything is good. Any questions, folks?
At this moment, no current questions.
Shot. Have we shown the video on how the DLDR is done? Shot.
Yes, we have.
Shot. So we showed the video on how herniated disc cause neck pain.
Yes, we have. Yep.
And how the DLDR repairs the disc.
Correct.
And how the DLDR is the best treatment.
Yes.
Oh, lovely. So we're done with our educational video. Shot.
Yes, we are.
All right, so I'm having trouble injecting the dye into the disc space, which happens, Shot, when there's a lot of scar tissue inside the disc. All right, like we have right here, right now. Why is there so much scar tissue? Well, this patient's had inflammation in his disc for 30 years. We saw that on the last disc. Remember, there was all that calcification and scar tissue in there. We cleaned out the stuff that matters. We're going to do the same here. Shot. All right, we're bringing in the tube. The entire surgery is done with a 4mm tube. You can see that tube on the lateral view. Shot. I'm advancing the tube through the disc space to the back where the problem is. All right, that looks pretty good. Looks pretty damn good. Happy with that. Shot. The tip of that tube is at the back of the disc, and it is looking right at the herniation and the annular tear. Good job, everyone, so far. We got about 10-15 minutes left. All right, Berndes? 10 to 15 minutes. 10 if it goes quick and easy, 15 if it's hard. All right, any questions from the audience?
At this moment, no current questions.
All right, everyone's doing a great job. Let's keep up the good work.
2 off, please. Thank you.
Laser on, shot, sorry. All right, there's your herniation. Again, lots of calcium, that's the gold, white stuff. It's white before the laser hits the calcium. It's gold after the laser hits the calcium. So, white becomes gold. That's calcium deposits. Why would there be so much? There's a piece of herniation. All these are pieces of herniation. This thing right here is herniation. It should not be here. It belongs in the middle of the disc. We are way past the middle of the disc. We're in the back of the disc where the tear and herniation are. So what happens in a herniated disc? You guys saw it on our video. The patient suffers a traumatic injury to their neck or back. That injury shakes the spine so violently that the wall around the disc, called the annulus fibrosus, very strong, it's like a strong tendon, it actually rips. And we call that an annular tear. If the tear happens in the front of the disc, we call it anterior annular tear. If it happens in the back, it's a posterior annular tear. The only tears that end up hurting people and causing symptoms are posterior, in the back of the disc, which is what we're dealing with right now. That is the tear right there. You can actually see the tear. I'm cleaning the tear, debriding it, because it's full of scar tissue. All that is scar tissue that I'm zapping with the laser. Okay? Now, there's more scar tissue, more herniation. There's a big piece of herniation right there. You guys see that white thing I'm zapping? That
Yes, we do.
literally is a herniation sitting there underneath the tear, outside the tear, up against the spinal cord and nerve. That's pushing on his nerve right there. So I'm cleaning all that out. And look how precise the laser is. It is so precise, you can use this laser with 1/20th. That's a millimeter, 1/20th of a millimeter. You take a millimeter, which is very small, and cut it into 20 equal parts. That's how precise the laser is. Look at that herniation. I'm just zapping it away. This thing is old. It's hard. It's like a piece of hard cheese. I would say maybe not a Gouda. I'm thinking about, what am I thinking about? Manchego? I'm thinking Manchego. This is like a piece of Manchego cheese right here. It's crushing. Jarlsberg? No, Jarlsberg is too soft. Jarlsberg is my favorite Swiss cheese, by the way. I love Jarlsberg. Oh, yeah. Got a nice chunk of Jarlsberg at home in my refrigerator right now. I'm going to go home and have it tonight. All right? My kids always say I'm a cheesy guy. I'm sure it's for a different reason, though, right? Any questions?
At this moment, no current questions.
Damn. It's really hard. There's no contrast.
I know.
It's all just white. That's where you get into trouble. That's because we couldn't inject the dye. There was too much scar tissue. The blue dye wouldn't go in. So we can't stain the herniations blue because we couldn't get any dye in because there's too much scar tissue. That's a piece of herniation right there. I can tell by where it's positioned. Sitting on the nerve, just crushing it. Oh yeah, come on now. Oh, it wants to come out. I can tell it wants to come out. All right. I don't want to get too carried away. We're going to flip, go to the other side. Any questions?
At this moment, no current questions.
Oh, this is just so dense. Such thick, hard, dense scar tissue in the back of this disc. Look at all that yellow. That's all calcium. What we call dystrophic, D-Y-S-T-R-O-P-H-I-C, calcification. Dystrophy. Dystrophic calcification is calcification of abnormal tissues in the body happens with injury and inflammation. And these disc injuries have a lot of dystrophic calcification. Any questions?
At this moment, no current questions.
They know everything, huh?
Here so.
All right. There's a big piece of herniation right there. Oh yeah, come on. Come on out. Let me try to grab that thing. It doesn't want to come out. Yeah, thanks. We got about 5 minutes left, folks, so if you're going to ask a question, ask it now. Look at this. You see the herniation? See how big it was? Henry?
Yes, we do.
On the video, it looked big, but it's only about 3 millimeters long. 3 mm. Okay? Little asteroid. You get enough of those back there, and they start pinching nerves and the spinal cord, causing paralysis. Okay? That's what we're here to remove, is all those little herniations. Here's some more. Let's flip it. Just about finished. Remember, this patient, we've already done his back. We did his facets in the back of his neck. We did his lumbar facets on the right side at 4551. We did his SI, his piriformis. But this disc is massively scarred. This is an old injury. He said he's had pain for 30 years. This is a big part of it right here. All the inflammation happening at the back of this disc. I'm literally peeling away about 1/20th of a millimeter at a time of the herniation. Honestly, I looked at his MRI and I didn't appreciate this much herniation back here. But it's here. That's why the MRIs are not entirely reliable, folks. You've got to have a surgeon who knows what he's doing to really make the right diagnosis. Look at all that. That's amazing. This stuff has just been pushing on his spinal cord for years. I don't know. I wonder if he's had a procedure done. Did he have a disc seal? Because this looks like he's had something injected in his disc. I bet you he's had a disc seal. Huh? This is what it looks like when you have a procedure where they inject stuff inside your disc. This looks like he had a procedure done. I just wonder, is it in his history? I'm going to have to ask him. I don't recall. Yeah, I don't either. Yeah, but the thing is, some people are afraid to tell us what they've had done. I know that for a fact, because they think we're not going to do surgery on them if they tell us everything. They think that we're going to say, sorry, you're no longer a candidate, huh? Oh, that's the dura down there. Wow. You guys see how thin it is? Right in the middle?
Yes, we do.
That's scary. Whatever he had done to this disc is very unusual. That's all I can say, is very unusual to have this much scar tissue in a disc. I have to say I've never seen quite this much scar tissue in one disc. This looks to me like something was done. Well, what a mess. What a mess it's created for him. Whatever he did. I'm going to ask him. Maybe he had nothing done. I don't know. But this is extremely unusual to have this much scar tissue. All right. We're pretty much done. Berndes, you ready? Yep. Any questions?
At this moment, no current questions.
All right. I don't see any more herniation except for this right here. Let's see if we can't get that out and we're done. Any comments?
At this moment, no current comments.
All right. Well, we hope you guys enjoyed, and maybe we'll leave the stream with a nice testimonial, huh? I'm seeing more of this stuff. Let me try to grab it out. Let me just take one more peek, guys. Just got to do one more peek. That's the one that was wrapped around the laser fiber, so you know it wasn't going to go easy. Yeah, there is some more right there. Look at that. That is a lot that was just sitting there waiting.
Oh, we just got
There it
a
is.
question.
Look at the size of this herniation, folks. I just pulled this out. This was all that junk sitting in the back of his disc. Look at the size of that right there. Look at that. Put in the tape measure. My God. That was like a sonometer, 12 millimeters. Okay? That's it. We're done. We'll take the question.
Coming from
Here, take this.
Mike, once more on YouTube, asking Dr. Deuk, is this the worst disc on record?
Well, to be honest, I think in ways it is. I think it's the most scarred disc. I wouldn't say it's the most collapsed disc. The worst discs can be the most herniated disc, the most scarred disc, and the most collapsed disc. All right? And it's not the most collapsed disc, it's not the most herniated disc, but it is the most scarred disc on record. Yes. I would have to say yes. So he does get a prize. He wins the most scarred disc in history at Deuk Spine. Okay? All right, so just for those of you who don't know, that's his face. He's looking up at the camera. This is his neck. We're on the right side of the neck. The trachea and esophagus are here. The left side of the neck is over here. He's got a thick, thick, thick neck. It did not make my surgery easy. It made it very hard. I would love to have operated on the two discs above, number 3, 4, 4, 5. It would have been a lot easier for me technically. It made it easier, but they were not the ones causing his pain. So we went for the one that was causing his symptom, the 2. And that's number 5, 6, 6, 7. So it's about doing what's right for the patient, not doing what's right for the surgeon. And that's our commitment at Deuk Spine. We always do what's best for our patient. All right, let's take a look. Beautiful, beautiful, beautiful. Look at that, folks. That's a 4 millimeter incision. Put the tape measure, 4 mm. That's less than a 1/4 inch. No bleeding. Looks great. We're going to thank you, Dr. Berndes. Thanks, everybody. We'll be back with one more surgery. It's a bilateral SI joint, DPR. Thanks for joining. Dr. Deuk Machen here at the Deuk Spine Institute with a patient who traveled here from Colorado with her husband, and she underwent the cervical Deuk laser disc repair for 2 herniated discs in her neck. And how are you feeling today?
Great. Even on the way home, I felt all the pain released from my arms and my shoulders. I didn't realize how much pain I was actually in. So my arms just feel light. And sitting in the waiting room here earlier, I realized my neck is not hurting at all and my headache is gone.
So your headaches are gone, your neck pain's gone, and your arms are starting to feel normal again.
Yeah, yes.
Amazing, isn't it?
Yes, so amazing. I'm so grateful.
Yeah. Tell me what life was like for you before you came to Deuk Spine Institute.
We have 4 small children and it was very hard because we homeschool. My oldest started taking over laundry. I couldn't get in to the washer to get the clothes out. He has to help a lot with the little ones with school. I was in bed a lot with pain and laying down hurt. So then I would sit up in the recliner and I wasn't sleeping at all. Last night I slept.
Congratulations. Now, are you feeling good here today because we gave you lots of pain medicines, or are you on any pain med at all?
No No, I didn't even take ibuprofen. I think in the IV there was Tylenol. I didn't even take the muscle relaxer, no pain meds.
Yeah, the pain meds from surgery wore off yesterday.
Yeah.
And today your body has no pain meds and you have no pain.
No pain.
Congratulations.
Thank you.
Now, it must be hard with such a severe, debilitating neck and pain and headaches when you have kids because, you know, your whole life is all about having kids and bringing them up and engaging with them and being part of their life. And when you have pain like that, it takes your time away from your kids. It takes your quality of life away. So you had to do something about this.
Yeah.
And did you have any treatment in Colorado?
They wanted me to do an epidural in the neck because there was no room in the spinal cord. That made it worse because the fluid had nowhere to go. So I did that, and then the surgeon in Colorado wanted me to do a fusion and basically laughed when I asked if there was other options. So that's when it led us to do more research and watch all of his videos and know, I just knew in my gut this is where we had to come.
Yeah, you're right. I'm glad you did not choose the fusion, but why did you not choose the fusion? What were you worried about?
I was worried that I have 4 young children, and if I do a fusion, it would be worse, and then it would just keep continuing all the next discs. And I was really having like a claustrophobic feeling of I won't have any movement. I'll lose my mobility if I do a fusion.
And with the Deuk laser disc repair, you can see we went in with a 4mm incision. There was no bleeding. There was no hospitalization. She was asleep for an hour while we did her procedure, and you basically woke up pain-free.
Yes, I was actually very emotional when I woke up because I was like, our whole family needs to come here. All of our parents are in pain, so this is where you need to come.
We'll take good care of them here. Well, share with the audience watching what life is going to be like for you now and anything you want to tell the audience.
I feel like when you're in chronic pain for so long, you start to have anxiety, have maybe a little bit of depression, and all of that has completely lifted. And I think doctors will be like, oh, you're just depressed, take this medicine. But that's not what it is. It's the pain, the chronic pain. So I know that my quality of life will be much better now. My 2 boys play hockey, and there were so many times I couldn't sit in the stands. So it's really exciting.
Congratulations.
So, yeah.
All right. Well,
Thank
enjoy your
you.
life with your family.
Yes, thank
All right.
you.
Let's get